What's up everybody? Sean here with another Live to Roll video. So in this video, actually, we're going to be showing how to do assisted transfers. So I have my friend Alison here, who is a physical therapist, and she's going to show us how to do a full assisted transfer. Alright, here we go, guys. I guess, yeah, you can do the brakes too.
Alright, so there are a couple ways. Most important thing, lock the brakes. And if a quad is fresh out of surgery, then they're going to have a C-collar. So one of the first things you want to do is actually control the patient, come on forward, and see if they can fold all the way forward and look at where their head and neck is compared to their knees and see if this hurts their neck at all. So, and then help them come back up. So if they can get into that position and you can help them up and down of that really well, then you can do this kind of transfer. Okay, so first thing first, feet off, ground those legs. Okay, his feet are flying, check that out, woo! Okay, and make sure they're grounded. Like, okay, calm down. All right. Whew. So legs are grounded. Okay. So what you're going to do is fold him over this way towards my right hip, away from the seat. So I get his butt to the seat first. Okay, and then careful here. So my knees are blocking his knees. Got control over that. And sometimes what I'll do is take their hands out of the picture in case they are too weak, or have them supported. They can try to help. So I grab them by the britches. Okay, lean back. I've got their knees blocked, and so if I have good control here, I can put them back down in the seat, no problem, and move in slow motion to the seat here. Okay, and he's pushing himself up really well, but most new patients can't. And so you hold on to them. Get the wheelchair out of the way. Get their legs straight. And here, the easiest way to scoot their butt is to use their knee, grab their pants, and push their knee back. And now he's in a good spot to lean back. He has really good trunk control. Most new quads don't. So, now to get him back into the chair, get the wheelchair close, make sure the corner is touching. Okay, his feet are at a good angle. Okay, and I need him to scoot forward first. Easiest way to scoot someone forward is grab their knee, lean them forward. Oops, sorry. Okay. Grab them by the butt and scoot. And scoot again. Okay. And then get them back up. Woo! Bouncing legs, get those stable. Okay. So you're going to have one foot underneath his wheelchair. Hold him down this way. Okay. And so there's a big gap between his butt and his seat, like a good 90-degree angle. So we're going to do this in increments. Okay, so lean back and scoot. Make sure his hand gets out of the way. Lean back and scoot a little bit more. Okay, and scoot completely over. Okay, so now this works for me. Ooh, his legs are flying. And so lean him forward again. Okay. To scoot his hips back in the seat and pick up his knee. Use the pants and scoot his butt back. Okay. And get his legs back up. Bam.
That was the first time I've been transferred in a while. Fully transferred.
Now in that increment, actually when you're closer to the wheelchair for someone taller and bigger, you would get your leg out from underneath the wheelchair because it would block a little bit.
Okay.
So we could also do it from behind. And so you get his feet down. And ground his feet. Make sure they don't fly anywhere. Have him fold over first. And you're like, okay, his feet are staying here. He's okay. He's not going to fall on his face. And you can have him let go. So let go both hands and just hang. And he's nowhere near falling on his face. So even if he can't help with his hands, you can control his butt. So make sure one leg is on the seat, one leg's on the ground. Okay. And we're gonna go up and over. I don't do this very often. Okay. You ready, Sean?
Yeah.
Okay, so his butt is going to go up and over. You want to make sure you keep his hips, pull his hips towards you, and turn. Okay. Okay. And his hips are nice and securely in the seat. His legs are on the ground. You can give him a little help coming up. Woo! His legs are flying. Woo! I'm gonna move the wheelchair out of the way. And he's sitting nice and crooked.
Yeah.
Okay. Get his legs underneath him. Okay. He's sitting pretty crooked, so I'm gonna take him up. There you go. And I personally like to go from underneath, forward,
Okay.
and then take him by the hips. Okay?
Yeah, that way it's easy too. It gives you like some stability.
Yeah. Okay, so we can use that way to show you how to get him back in the chair. The thing is that you try not to have your shoulder choking him in the neck. But he's a friend, so why not? So with this one, his hips are way far back, so this requires quite a bit of practice, guys. Make sure the chair is close enough. Okay, so I'm going to take him forward, and I want his head away from the seat, hips to the seat, so I can see where he's going. Okay, and I lean back and scoot. And I got his knees blocked really good. And scoot. And bam. Okay. Now I let his legs spaz a little bit. Okay.
I forgot, I'm not helping.
And in a second I'm going to reposition him. When his leg decides to come down, come on, back down to earth. And so you see his hips are scooted to the right, so I gotta scoot him left. An easy way of doing this is just coming to the side, making his pants pull. Now he's more in the middle. And then sometimes it's easier with their legs on the leg rest. Okay, and then have him lean forward. Whoop. Leg ran away. Bouncing all over. Okay, lean him forward. And then grab his pants and booty scoot him back. Okay? So here really it's all about the hips against his knees.
Awesome. Thank you for the demonstration, Alison. Yeah,
This is how he does it all by himself because I'm just going to cheerlead.
Alright, yeah, I guess I could do one of them.
Are you wedgied?
A little bit.
When you pull on the guy's pants, de-wedgie them after. Ladies too.
Yeah.
Especially when they're newly out of the hospital.
Those are some helpful tips.
Because family members love pulling on their family's pants and taking the hips and yanking them up and lifting them without repositioning after. Everyone gets a wedgie. Please help them out and get rid of the wedgie.
Thank you for that. That is definitely good advice on that. Alright. So yeah, I think I should just do an assist or a regular one?
Yeah.
Alright. So this is how I have now developed and gotten my transfers down. So same thing as when she was transferring me, I pull up close to the surface I'm transferring to. Legs down.
Everyone gets scared of seeing someone paralyzed in this position because everyone thinks they're going to fall on their head. Your butt and stomach is behind, which is way heavier than the head, which is why it's so easy for him to do this. Because he's got to be able to lift that heavy butt to scoot it and not drag the butt to create a pressure ulcer.
Right, and that's why using my type of transfer, so I'll unlock this too. And I don't have the cord to support myself, so I'm holding myself up to lean across and then try to push back up here.
And you saw him kind of falling forward, that's normal.
Yeah.
So actually new quads really need to learn how to control their momentum or even let them quote unquote fall in different directions to help them move better.
And the way I learned this transfer was by having somebody, it started with a full assist, but like how Alison had me kind of like hang my hands down, I actually would try to push my hands and just push with everything I could. And when the person helping me would feel my push, they would do the push or the pull, whatever the lift. And it kind of eventually got to the point where I was actually assisting, because at first I was doing nothing. And then eventually I was assisting a little bit. And then over time, I got to the point where I was doing most of the lift. And then I eventually got to where I could do the full lift. So it just was a lot of practice and time and strength building.
So how long did it take for you to be able to do this entire transfer by yourself?
Probably 6 months of...
The first year. So it was never too late. Whenever they tell you...
Oh no, so that was, I think I probably wasted my first year. We're not really trying to do a lot and transferring stuff. Once I started actually working on it, which is probably close to a year into my injury, it took me 6 months. From the point where I started actively trying to work on it.
So he got this 1.5 years after injury. Everyone says after the first 6 months, you're toast, there's no more improvement. You can keep having improvement for the rest of your life because the body's moldable and he can move, which is awesome.
Yeah.
So he takes advantage of that folding over because it's so stable a lot. It's just super scary for new patients.
Yeah. Folding over helps a lot to stay, because when I'm down here, I can scoop my butt. From here, I can slide easily. I can move the butt and then sit back up. From this position, I would have a lot of trouble trying to stabilize myself and scoot if I was trying to actually scoot myself. Like I can try, see I can, because I'm gotten strong, kind of do it, but you see how much that moved compared to when I had my head down and how easy it was for me to...
And there's a huge height difference for him to lift. He's got no triceps to do that.
Yeah, so that is a big difference here. And then the other thing that helps with that is by putting my lead foot on the footrest, and it gives me a little bit more height leverage, or it keeps my leg more bent to...
It basically sets up his butt to hike up onto that seat.
So I just scoot a little bit in and get real close. And once I'm in a good position here, I do my arm under elbow positioning. I reach across to get both legs. Little scoot, and then I'm gonna slide the elbow forward so I have some more space for my butt. And then I basically have my arm locked here, and I'm pushing just all shoulder and back.
He pivots on that elbow.
And then pivots on the elbow, yeah.
It looks kind of sketch from this angle, I have to tell you. But it's a great pivot point. And it's also in pretty slow motion with great control.
Yeah. For a quad without triceps, it's definitely more efficient and easier than a lot of transfers.
Nice.
So that is the full assist transfer and partially assist and no assist.
Awesome. I think it was 2 total assists.
Yeah, it was 2 total assists.
2 total assists and 1 totally independent.
And then just kind of the technique of how I learned how to go from total assist to independent, which was just trying to basically teamwork. So you gotta work with the person that's helping you, you know, you push, they push. And it's a combination, and eventually you'll build up that strength. But alright, thank you guys for watching the video. Appreciate you guys checking it out. If you're not already subscribed, click that subscribe button, click the like button, comment any questions down below. Follow my friend Alison here. She's an awesome PT. And find yourself a good PT in your area. It's really important to get good therapy. Because if you don't get the right therapy at the beginning, you can really halt your independence. So it's really important. Alright, thanks everybody for watching. Take care guys, live to roll. Fist bump.